this. And of course, the evidence still suggests that is far less likely than human to human.
Correct.
But again, we learn every time, so if there is anything to suggest that that is the source, then of course we always review our settings, always.
What's your advice to MPs and ministers scattered around the rest of the country?
Yep.
Are they supposed to come back to Wellington,
Yep.
or what's the deal?
So same as before, and unfortunately we have been here before. So for level 2, people who are outside of Auckland, they are of course able to travel to Wellington. For those who are in Auckland, it actually ultimately comes up to the discretion of the leaders of those parties, because parliamentarians have on previous occasions still travelled to Wellington under those circumstances. I can share with you as Labour leader, I've advised my Auckland-based members to stay where they are.
Any discussions about economic support for businesses that will have to close in Auckland?
You'll remember that after a period of 72 hours, that's when we look to put in place economic supports again. So look, that'll be something that we will be talking to directly as we move through and we get a sense of whether or not we will be staying or lifting out of those restrictions.
Will the lockdown slow the vaccine program?
I see no reason why it would. Every movement around the vaccine program we see as essential. Dr. Bloomfield?
Yes, so the team continues the planning apace, and we've got the team that's working on the vaccine, including the Deputy Chief Executive that's responsible for both the response and the vaccine. We split our work today, so I've focused on the response and she's focused on continuing the work on the vaccine. So,
will it produce like any late changes in prioritisations of who should get the vaccine?
Well, at this point, the scenario that we are planning for is one of no or low community transmission. So at this point, we'd continue, and I guess this reinforces the importance of us vaccinating our border workforce as soon as
and reinforcing why all those who are on surveillance testing are amongst those who would be first. Yeah, Thomas, and then I'll come to Jason.
No economic support for any businesses for the next 72 hours, but a lot of hope that it may lift.
If it's longer than 72 hours, of course, we move at that point. At the last occasion that we moved into level 3.
Are you hopeful that the celebrity period will be shorter than 72 hours?
I am always hopeful that we can do get ourselves through this safely with as little impact as possible, which is why I flagged we will take seriously those 24-hour reviews. We will not stay there any longer than we believe we need to. And so the first one will be at post-cabinet tomorrow, so 4 p.m. tomorrow is when we will be making our first announcements, plus sharing any additional information that's pertinent.
And on LSG Sky Chef, I mean, will you be expressing concern that they have not made sure a worker has a routine test while on annual leave? And will you be confirming that they are in fact using PPE in that setting?
Of course, we'll follow both those things too up. I should say that one of the tools we've made available to all employers whose workforces are being tested as part of the surveillance program is a border workforce testing information system. Many of employers have taken up that information system and process. Some haven't, and this is one, so we will be talking to them and I guess other employers. It's to assist them in their responsibilities to look after the health and safety of their employees. So we will just see if perhaps the use of that information system may assist them with making sure that they are reliably testing all their employees.
One thing again, I will just reiterate that it's not actually clear that even had they had on the 1st of February that it would necessarily have picked up this case, which is why it is so important that as this person did, as soon as they experienced symptoms, they were tested.
Could have provided you with some extra reassurance though in making today's decision though, correct?
And how so?
If they tested negative, you know, all in February.
Well, I mean, what we know is the period in which they were symptomatic would have been a 10-day period. So from the point that they may have been tested to the point they were symptomatic. So a little bit less likely. But again, as I say, very important that anyone that has symptoms, even if they're in a regular testing regime, we still ask them to be tested outside of that regime.
Today's decision mean for the Prada Cup racing on Wednesday?
A very good question. We've been having this discussion. They have made the decision already to postpone Wednesday's racing. They, of course, already had Thursday as a postponement day. They haven't confirmed when the next race will be. I imagine they'll be doing exactly what the rest of New Zealand is doing and keeping an eye out on the new information that comes to hand. Audrey?
Yeah, if you're reviewing it tomorrow, I mean, is there any chance that it could actually be lifted tomorrow night, or the earliest it could be lifted would be Tuesday night?
A couple of the things that we'll be looking for, just to give you a sense of the things that we'll want to work our way through. really getting through the testing at the high school. So I really ask people again, students, staff members, community members there who have that contact at the school, to make sure they come to that site and get tested. Testing of those, those contacts, finishing off the close contacts around the work site and the information from the genome sequencing. So we should get a early-ish picture, but we may not have all of it in that first 24 hours.
Realistically, the earliest it could probably be lifted would be Tuesday night, not tomorrow.
We'd have to
would
build a
have the
picture
result.
very, very quickly for it to be by 4 p.m. tomorrow, realistically. And I think people can see that by what we need to get through.
I appreciate it, it's been
I'll come just over here again, and then I'll come back over to you, Jenna.
If you identify further spread in New Plymouth, would that make a case for expanding a level 3 down to Taranaki, or would it be a sort of nationwide alert level change?
I imagine that the advice we get is always based on the individual circumstances. You'll remember in August we did have cases outside of Auckland, but we were pretty clear that they were very easily, that they were contained and identified how they came to be in contact. So we'll always assess what a case tells us before we make those decisions.
Yes.
Yeah, Joe and then Jenna.
Have you had any indication of how good scanning has been in a lot of these places? It's probably a bit early to tell that,
Yeah.
but presumably that would go a long way to ensuring people can get tested sooner rather than later.
What I can say is that the cases, the ones who travelled down to Taranaki, weren't using the scanning function, the QR code scanning on their apps, but that they did have Bluetooth turned on for most of the time, so that will identify some people who notifications will be sent to. But now that we do know those locations, we can send a notification out to anyone who did scan into those locations with the QR code at those times, and so they should expect a notification.
A good timely reminder too for everyone, please turn on the Bluetooth function and keep scanning. The Bluetooth function is not a substitute. It doesn't tell us precisely your venues, it just tells us those you were nearby. We still need those venue lists, so please keep scanning and turn on Bluetooth.
Do you keep a check on that? I mean, have you had any indication, I guess, over the last week or so, I don't know how regularly you check, as to whether things have dropped off or whether people...
We do. It is part of the reporting that we observe is what people are doing. We saw off the back of the Northland situation things lift again, but
Yes.
New Zealanders can be a little complacent quickly, unfortunately.
Yes, so the scanning lifted after Northland. It's dropped back slightly, but it's stayed at a higher level. I would hope that this is a point in time when right around the country people
Just keep it up.
to keep doing it.
Gina, then I'm going to finish with Audrey. Audrey.
Oh, do you know whether police are going to set up those roadblocks like they did last time, which appeared to actually create incredible queues on the motorway, southern and northern motorways?
So yes, they will. My understanding is that's most likely expected to be in place from the morning. In the first 24 hours, when those checks are undertaken, I understand it's very difficult to get documentation ready or evidence to demonstrate why you need to move. And so you won't need to have that within the first 24 hours to be able to move through. But after that, of course, we put back in place the usual checks that we ask of everyone moving through the border. And the one other thing, just really worth reminding, those who are affected know they were affected last time. They'll remember that we did add people to exemption lists. So it was the border at level 3, as it was when we finished level 3 last time, that will be back in place. So people will know if they managed to get those exemptions last time.
quickly follow up on that. How quickly will you be able to get that info up on MB website so there's no confusion like there was last time?
I'll need to perhaps get that information out separately to all of you, but I understand that the MB portal is still the place where people need to go. But as I say, not requiring people to have that documentation in the first 24 hours I think will be really important. MB have also changed up their systems to make it more efficient than what people experienced last time.
Flights, just the
Yep.
Air New Zealand flights, I presume you've been working with Air New Zealand.
Yes, we have.
So people leaving Auckland should only be those who are returning to
Yes.
their homes in other parts of the country.
As it was last time, we understand people need to relocate. They may be in Auckland, but not be intending, that's not their place of residence. So if you need to relocate, either into Auckland or out of Auckland, you can, but we ask everyone else, please don't move around.
People can plan. When is Cabinet meeting tomorrow? And when will you make further announcements tomorrow?
So we're meeting at the usual time tomorrow, but post-cabinet will be at 4 p.m. tomorrow. And that's when we'll give you updates and any further information that we may have to hand around our current settings. But as you can see, a lot of work to get through and a late night tonight as we work through some of that evidence. All right, everyone, I'll come back to you tomorrow.